Hey everyone, and welcome to another deep dive with us. Today we're going to be tackling something that might seem a little technical at first, uh, pediatric respiratory assessment.
Yeah, it sounds a little dry maybe, but honestly, it's incredibly fascinating once you start to think about it.
It really is, and plus breathing, kind of important.
Absolutely vital. And what's really cool is even if you're not a doctor, understanding how healthcare professionals evaluate breathing problems in kids can be so insightful.
Okay, so you've convinced me. Where should we begin? I know we have a chapter from a medical textbook and some visual aids too to help guide our deep dive.
All right, well, just like any good investigation, we need to gather information.
Oh, you mean like a detective? I love a good mystery.
Exactly. And in the medical world, that's where the patient history comes in.
So it's more than just, asking what brings you in today.
Oh, yeah, much more. There are several key elements that doctors focus on. They start with what's called the chief complaint, which is basically the main reason for the visit. It could be a specific symptom like a cough or a known condition.
Okay, so that's the starting point, but then they dig deeper.
Right. They'll go into the history of the present illness. So, for example, if the chief complaint is a cough, they'll ask about the details of that cough. When did it start? How often does it happen? Is it worse at certain times? Are there any triggers like exposure to allergens or smoke?
So they're really trying to understand the nuances of the problem, not just checking boxes.
Exactly. And then, of course, they'll ask about the child's medical history, past illnesses, surgeries, allergies, any medications they take. This gives them crucial context.
Right, a history of asthma, for example, would totally change how a doctor interprets a current breathing problem.
Absolutely. And then we can't forget about the review of systems, which is a more general look at the child's overall health. It might seem strange to ask about, say, digestive issues when you're focused on breathing.
Yeah, why would they do that?
Well, because the body is all connected. Sometimes symptoms in one area can be related to problems somewhere else.
Okay, so it's about seeing the whole child, not just the lungs.
Precisely. And then there's family history, too. Knowing about conditions like asthma or cystic fibrosis that run in families can be really important. It helps doctors understand the child's risk factors and potential predispositions.
So even if the child isn't showing symptoms right now, that family history adds another layer of information.
Exactly. And then lastly, doctors will consider the child's social and environmental history. Think about things like living conditions, exposure to secondhand smoke, recent travel, even socioeconomic factors. All of these can have an impact on respiratory health.
Wow, it's amazing how much information they gather just by talking. It's like they're creating a detailed profile before they even examine the child physically.
It's a crucial first step.
Yeah.
And speaking of hands-on, the next stage is the physical examination. This is where the real detective work begins.
Okay, I'm ready for it. What are the key components of this exam?
It involves four main techniques: inspection, palpation, percussion, and auscultation. Don't worry, we'll break each one down so it's clear what's happening.
All right, I'm all ears. Let's start with inspection. Is that just looking at the child?
It is, but it's much more than a quick glance. Doctors are trained to observe subtle details that can give them clues, and it starts with the vital signs.
Right, heart rate, respiratory rate, temperature, blood pressure, and oxygen saturation, that kind of thing.
You got it. These numbers are super important because they can flag any immediate concerns. For example, an elevated heart rate or rapid breathing could indicate that the child is working harder to breathe.
Makes sense. It's like their body's trying to tell us something's not quite right.
Exactly. And then the doctor will zoom in on specific signs of respiratory distress, both pulmonary and non-pulmonary.
Hold on, non-pulmonary. That sounds a bit contradictory. Isn't it all about the lungs?
You'd think so, but sometimes the body shows signs of struggling to breathe in other areas beyond the lungs. It's like a way of compensating for difficulty getting enough air.
Okay, interesting. So what are some examples of those non-pulmonary signs?
Well, think about things like anxiety or fussiness, or even a change in their level of alertness. You might also see things like head bobbing, grunting, or their nostrils flaring with each breath. And then there are retractions.
Retractions. That sounds a bit serious.
It can be. It's when the skin between the ribs or around the neck pulls inward with each breath. It means they're having to work really hard to pull air in.
Wow. I can only imagine how scary that would be for parents to see.
Absolutely. And on the pulmonary side, the doctor will be looking for rapid breathing signs of breathlessness and cyanosis, which is a bluish discoloration of the skin.
Okay, so basically any indication that the child is having trouble breathing, whether it's obvious or subtle.
Precisely. And the inspection goes even further. They'll look at the shape and movement of the chest wall to see if there are any abnormalities.
Like what kind of abnormalities?
Well, for example, a barrel-shaped chest can sometimes indicate a chronic lung condition. They'll also look for things like pectus carinatum, where the breastbone protrudes outward, or pectus excavatum, where it's depressed inward.
Wow, those sound pretty dramatic. Can those conditions actually affect breathing?
Absolutely. They can restrict lung capacity and make it harder to breathe properly. Doctors will also check the child's muscle mass and strength, looking for any weakness that could be impacting their breathing.
Right, because breathing involves a lot of muscles working together.
Exactly. And they'll look at their posture, too. Things like kyphosis, which is an excessive outward curvature of the spine, and scoliosis, a sideways curvature. Both of these can also affect lung capacity.
Wow, it's incredible how much information they gather just by looking. It's like a puzzle with all these pieces fitting together.
It really is. And that puzzle solving continues with the next stage of the physical exam, palpation.
Okay, palpation. That's the fancy word for touching, right?
Exactly. It's about feeling specific areas of the chest to assess for things like vibrations, tenderness, or abnormal masses.
Hmm. What are they feeling for specifically?
One key thing is tactile fremitus, which are vibrations you can feel through the chest wall when the child speaks. They might ask them to say 99 because the repeated sounds create strong vibrations.
Interesting. So what do those vibrations tell them?
They can indicate areas of the lung where there might be fluid buildup or consolidation, which is like a solidification of the lung tissue, something you might see with pneumonia, for example.
Oh, so if the vibrations are stronger, that could mean something's not right.
It could be a clue, yes.
Yeah.
And they'll also assess pharyngeal fremitus, which is felt when air is moving through airways that are partially obstructed by mucus.
So that's something you might feel in a child with a chest cold who has a lot of phlegm.
Exactly. They'll also feel the child's neck to make sure the trachea or windpipe is in the midline and not deviated to one side, which could indicate pressure from a mass or swollen lymph nodes.
Wow, so even just slight shift in the windpipe can be significant.
It can be, yes.
Yeah.
Every little detail helps. Now, are you ready for a technique that might sound a little strange?
Bring it on. What is it?
It's called percussion.
Okay, I'm officially intrigued. What does that involve?
Basically, it's tapping on the child's chest with their fingers to produce different sounds.
Like playing the drums on their chest.
Kind of. But seriously, those sounds tell the doctor about the density of the tissues underneath.
So different sounds mean different things.
Exactly. A hollow resonant sound is normal. It means the lungs are filled with air, but a duller sound could indicate things like fluid buildup consolidation or a mass in that area.
So it's like they're using sound to see inside the chest.
That's a great way to put it. And it takes a lot of practice to master the art of interpreting those sounds.
All right, so we've inspected, palpated, and percussed. What's the final stage in this hands-on exploration?
This is when everyone pictures auscultation. Or listening to the breath sounds with a stethoscope.
The classic doctor move, but what are they actually listening for?
Well, first they're checking for normal breath sounds. Those soft, breezy sounds that indicate clear airways.
Kind of like the sound of wind through trees.
Perfect analogy. But they're also listening for any abnormal or adventitious sounds, which can signal a problem.
Like what kinds of sounds? I've definitely heard wheezing before.
Wheezing is a classic example. It's that high-pitched whistling sound often heard on exhaling that suggests narrowing of the airways. It's common in asthma.
Yeah, it really does sound like a whistling tea kettle.
Yeah.
Now, are there other sounds they listen for?
Definitely. Crackles are another common one. They're fine crackling sounds, often compared to rubbing hair between your fingers. They can indicate fluid in the small airways, which you might see with pneumonia or bronchitis.
Okay, so the type of sound gives clues about what's going on.
Exactly. Stridor is another important sound to recognize. It's a high-pitched, harsh sound usually heard when breathing in and suggests an obstruction in the upper airway, like the trachea or larynx.
That one sounds pretty serious.
It can be a sign of a serious condition, so it's definitely something to watch out for. And then there's Störspurter, which is kind of a snoring sound that can happen when breathing in or out. Often that means there's a partial obstruction in the upper airway, like the back of the throat.
So it's not just about hearing an abnormal sound, but also paying attention to when you hear it inhaling, exhaling, or both.
Exactly. Doctors are also listening to the intensity and location of the sounds. They'll listen to different areas of the chest to see if the sounds are louder or softer than expected, which can help pinpoint where the problem might be.
So it's not just a quick in and out with the stethoscope. There's so much detail involved.
It really is an art form. It requires a trained ear and careful attention to pick up on those nuances.
Well, we've covered a lot of ground already. We talk about the four main components of the physical exam inspection: palpation, percussion, and auscultation. It's amazing how much information doctors can gather just through their senses.
It really is a testament to their training and expertise. But the physical exam isn't quite over yet. There's also something called the non-pulmonary examination, which involves assessing other areas of the body that might be related to or impacting the child's breathing.
That's fascinating. It makes sense, though, if you think about it. The body is all connected.
Yeah.
But which areas are we talking about here? And what are doctors looking for specifically?
So let's break it down. They'll examine the eyes, ears, nose, throat, heart, abdomen, skin, and even the extremities. And each of these areas can provide clues about underlying conditions that might be contributing to or even impacted by respiratory problems.
Wow. Okay, I am definitely intrigued. Give me some examples.
Sure. So, for example, they might check the eyes for signs of conjunctivitis, which can be a symptom of allergies that also affect the respiratory system. Or they'll examine the ears for signs of infection, as ear infections can sometimes spread to the sinuses and cause breathing problems.
So even something as simple as red eyes or a runny nose could be a piece of the puzzle when it comes to breathing problems.
Exactly. The nose and throat exam is especially important. They'll be checking for things like nasal congestion discharge and any abnormalities in the nasal passages that might be obstructing airflow. And they'll also look at the tonsils for swelling or infection.
It really makes you realize how interconnected everything is.
Yeah.
What about the heart? How does that relate to breathing?
Well, they'll listen carefully to the heart checking for any murmurs or abnormal rhythms, because sometimes cardiac dysfunction, meaning problems with the heart's ability to pump blood effectively, can lead to fluid buildup in the lungs, which then causes difficulty breathing.
Wow, that connection never would have crossed my mind. It really highlights how important it is to have a doctor who can see the whole picture, not just focus on one isolated area.
You're absolutely right. And then there's the abdomen. Doctors will palpate or feel the abdomen to check for any tenderness, enlargement of the liver or spleen or other abnormalities. Sometimes gastrointestinal issues can actually mimic respiratory symptoms, so it's important to rule those out.
So a stomachache could sometimes be mistaken for a breathing problem?
In some cases, yes. And lastly, they'll examine the skin and extremities. They're looking for things like rashes, discoloration, or swelling that might be related to allergies, infections, or other systemic conditions that could impact breathing. They'll also check the fingertips for something called clubbing, which is a thickening and widening of the fingernail that can be a sign of chronic lung disease.
It's amazing. Even the fingertips can give us clues.
They can. And during this whole non-pulmonary exam, doctors are also carefully assessing the child's growth and development.
Now, why is growth and development important when we're talking about respiratory health?
That's a great question. Well, you see, children with chronic breathing problems often have a harder time gaining weight and thriving. Their little bodies are working so hard just to breathe that they may not have enough energy left for growth. So monitoring their growth patterns can give doctors valuable insights into how serious their condition is and how much it's impacting their overall health.
That makes perfect sense. If a child is constantly struggling to breathe, they probably don't have much energy for eating and growing like they should.
Exactly. Now, we've talked a lot about observation and physical examination, but there's another tool in the doctor's arsenal: laboratory assessments.
Ah, yes, the lab tests. That's where things can get a little more technical, right?
They can, but it's important to remember that lab tests aren't always necessary. Doctors use them strategically to confirm a diagnosis, rule out certain conditions, or monitor how severe a child's respiratory issue is.
So it's not a one-size-fits-all approach.
Not at all. It's all about choosing the right test at the right time, always weighing the risks and benefits, especially when we're talking about children.
That's reassuring to know. They're not just ordering tests for the sake of it.
Exactly. And when they do use lab tests, doctors often follow a stepwise progression, starting with the least invasive options and only moving to more invasive tests if they really need to.
Okay, I like that approach. Start simple and only escalate if necessary. So what are some examples of these lab tests?
Well, one of the most common and least invasive tests is a chest X-ray. It gives doctors a visual image of the lungs and chest cavities so they can look for things like pneumonia fluid buildup or air trapping.
So it's a quick and relatively painless way to get a peek inside.
Exactly. Another non-invasive test is pulse oximetry, which we mentioned earlier. That's the one where they clip a sensor on the child's finger or toe to measure the oxygen saturation in their blood.
Oh, right. That one seems so simple, but it gives them important information.
It does. Now, moving into slightly more invasive tests, there's blood gas analysis. This involves taking a small sample of blood, usually from an artery, to measure things like oxygen and carbon dioxide levels in the blood, as well as the pH level.
Okay, so that one is a little more involved than a finger clip.
It is a bit more involved, but it provides crucial information about the child's lung function and their overall respiratory status. And in some cases, doctors might need to examine the airways directly.
How do they do that?
One way is through a bronchoscopy.
Ooh, that one sounds a little scary.
It can sound intimidating, I know,
Right.
but it's actually a very useful procedure. They insert a thin, flexible tube with a camera on the end into the airways, which allows them to actually see the trachea and bronchi.
So they can see what's going on inside.
Exactly. And they can even take samples of mucus or tissue for further examination if needed.
Wow, that's pretty incredible.
Uh-huh.
Are there other procedures used to examine the airways directly?
Yes, there's also a lung biopsy where they take a small sample of lung tissue for microscopic analysis.
When would they need to do a lung biopsy?
Usually it's reserved for cases where they suspect a more serious condition like cancer or a rare lung disease. It helps them get a more definitive diagnosis.
So the type of lab test really depends on the individual child and what the doctor thinks might be going on.
Precisely. It's all about choosing the tests that will give them the most useful information to make treatment decisions.
This whole process is so incredibly thorough. It really shows how much care and precision goes into assessing a child's respiratory health.
It really does. And it's a testament to the dedication and expertise of these healthcare professionals who are working so hard to make sure children receive the best possible care.
Absolutely. Now, before we wrap up this section, I want to go back to something you mentioned earlier about parents and caregivers being informed advocates for their children.
Yes, that's so important.
Can you talk a little bit more about that? What can parents do to be more informed advocates?
Well, first and foremost, trust your instincts. You know your child better than anyone. So if you notice any unusual breathing patterns, persistent coughing, or any other concerning symptoms, don't hesitate to seek medical attention.
That's such an important reminder. Sometimes as parents, we brush off our concerns thinking we're overreacting.
It's always better to err on the side of caution, especially when it comes to our children's health. And be prepared to provide a detailed history of your child's symptoms, including any triggers, medications, or previous treatments. The more information you can provide, the better equipped the doctor will be to figure out what's going on.
So it's like we're detectives too, gathering all the clues we can.
Exactly. And don't be afraid to ask questions. The more you understand about your child's condition, the better you can advocate for their needs and make sure they're getting the most appropriate care.
That's great advice. Knowledge is power when it comes to health.
Absolutely. And speaking of knowledge, I think we've covered a lot of ground today, from the initial patient history all the way through to laboratory assessments.
We have. It's been a fascinating journey into the world of pediatric respiratory assessment.
It has. And while we've focused primarily on the medical aspects, it's important to remember that there's a human element to all of this.
What do you mean by that?
Well, a child with respiratory distress isn't just a collection of symptoms and test results. They're a little person who's experiencing discomfort and fear. And as parents, caregivers, and healthcare providers, it's our responsibility to approach them with empathy, compassion, and a genuine desire to help them breathe easier.
That's beautifully said. It's a reminder that healthcare is about so much more than just the technical stuff. It's about caring for the whole person, both physically and emotionally.
Absolutely. And with that in mind, I think we're ready to wrap up this first part of our deep dive.
Sounds good to me. We've covered a lot of ground already, but I'm eager to hear what else you have to share. Welcome back, everyone. So before the break, we were talking about that non-pulmonary exam, where doctors examine areas beyond just the lungs. I'm still a little curious about why that's necessary.
It's a great question. I mean, it might seem a little counterintuitive at first, but remember, the body is all connected. What might seem completely unrelated to breathing can actually give doctors valuable clues about what's going on.
Okay, so it's about looking for those hidden connections. Can you give me some examples of what doctors are looking for during this part of the exam?
Sure, so let's start with the eyes. Doctors will often check for signs of conjunctivitis. You know, those red, itchy eyes?
Yeah.
Well, that can be a symptom of allergies, which, as we know, can also affect the respiratory system.
Ah, so it's not just an eye problem. It could be a sign of something more.
Exactly. They'll also examine the ears for signs of infection, because ear infections can sometimes spread to the sinuses and then lead to, you guessed it, breathing problems.
So it's like a chain reaction.
Mm.
One problem can trigger another. What about the nose and throat?
Oh, that's a big one. The nose and throat exam is super important. They'll be looking for nasal congestion, discharge, and any abnormalities in the nasal passages that could be blocking airflow. And they'll also check the tonsils for swelling or any signs of infection.
Makes sense. So even a simple runny nose could actually be a sign of a bigger respiratory issue.
Precisely. Now let's move on to the heart. Doctors will listen to the heart very carefully, checking for any murmurs or abnormal rhythms.
Okay, but what does the heart have to do with breathing?
Well, sometimes problems with the heart's ability to pump blood effectively can lead to fluid buildup in the lungs, and that fluid makes it harder to breathe.
Wow, that's fascinating. I never would have thought of that connection. It really shows how important it is for doctors to consider all the different systems in the body.
Exactly, and we're not done yet. There's also the abdomen. Doctors will palpate or feel the abdomen to check for any tenderness enlargement of the liver or spleen and other abnormalities.
Wait, why would they check the abdomen?
Because, believe it or not, sometimes gastrointestinal issues can actually mimic respiratory symptoms.
So a stomachache could be mistaken for a breathing problem.
It's possible,
Yeah.
so it's important to rule that out. And lastly, they'll examine the skin and extremities. They'll be looking for things like rashes, discoloration, or swelling that might be related to allergies, infections, or other conditions that could affect breathing. They'll also check the fingertips for something called clubbing. It's basically a thickening and widening of the fingernails, and it can be a sign of chronic lung disease.
So even the fingertips can give us clues. That's amazing.
It is. And during this whole non-pulmonary exam, doctors are also paying close attention to the child's growth and development.
But why is that important when we're talking about breathing problems?
Well, children with chronic respiratory conditions often struggle to gain weight and thrive. Their little bodies are working so hard just to breathe that they may not have enough energy left for growth. So doctors will carefully monitor their growth patterns to see how the condition is affecting their overall health.
That makes a lot of sense. It's like their bodies are prioritizing breathing over everything else.
Exactly. All right, so we've covered the physical exam in detail, including this really interesting non-pulmonary component. And where do we go from here?
Yeah, what about lab tests? Are those always necessary?
Not always. Lab tests are an important tool, but doctors use them strategically, not routinely. There are a few things they consider before ordering any tests.
Like what?
Well, first, they want to make sure the test is actually necessary and will provide them with valuable information. And second, they have to weigh the potential benefits of the test against the risks, especially when it comes to children.
That makes sense. It's good to know they're not just ordering tests willy-nilly.
Exactly. And when they do order tests, they usually start with the least invasive options and only move on to more invasive tests if they absolutely have to.
I like that approach. Start simple and only escalate if necessary.
Mm.
So what are some examples of those lab tests? Maybe we can start with the less invasive ones first.
Sure. So one of the most common and least invasive tests is a chest X-ray. It's basically a picture of the lungs and chest cavity. It lets doctors see if there's anything unusual going on in there, like pneumonia fluid buildup or air trapping.
So it's a quick and easy way to see what's going on inside.
Pretty much, and it's relatively painless too. Another non-invasive test is pulse oximetry. You know, the one where they put that little clip on your fingertip.
Right, that seems so simple.
It is, but it gives them important information about how much oxygen is in the child's blood. Now, moving on to slightly more invasive tests, there's blood gas analysis. This one involves taking a small blood sample, usually from an artery.
Oh, okay, so that's a little more intense.
It is, but it gives them really important information about the child's lung function and their overall respiratory status. And sometimes doctors need to actually see inside the airways.
How do they do that?
Well, one way is through a procedure called a bronchoscopy.
I've heard of that before. It sounds kind of scary.
I know it can sound a little intimidating, but it's a very useful procedure. They insert a thin, flexible tube with a tiny camera on the end into the airways. This allows them to see the trachea and bronchi and look for any abnormalities.
So they can actually see what's going on in there.
Exactly. And they can even take samples of mucus or tissue for further testing if needed.
That's incredible.
It is. And there's another procedure called a lung biopsy, where they take a small sample of lung tissue for microscopic analysis.
When would they need to do that?
Usually a lung biopsy is reserved for cases where they suspect a more serious condition, like cancer or a rare lung disease.
So it sounds like the type of lab test really depends on what the doctor is looking for and how serious they think the condition might be.
Exactly. It's all about choosing the tests that will give them the most helpful information to make the best decisions for the child's treatment.
It's amazing how thorough this whole process is. It's clear that doctors put a lot of thought and care into assessing a child's respiratory health.
They really do. And it's inspiring to see their dedication and expertise. They're true heroes in my book.
I completely agree. Now, before we move on, I want to touch on something you said earlier about parents being informed advocates for their children. Can you talk a little bit more about that?
Absolutely. Parents are often the first line of defense when it comes to their child's health.
That's true. We spend the most time with our kids, so we're usually the first to notice when something's not right.
Exactly. And that's why it's so important for parents to be informed and proactive. You know your child best. So if you notice any changes in their breathing, any persistent coughing, or anything else that seems concerning, don't hesitate to seek medical advice.
That's such important advice. Sometimes as parents, we tend to brush things off or downplay our concerns. We don't want to overreact.
I get it. But it's always better to err on the side of caution, especially when it comes to our children's health.
I agree. So what else can parents do to be good advocates for their kids?
Well, when you do talk to your doctor, be prepared to give them a detailed history of your child's symptoms.
Like what kind of details?
Well, things like when the symptoms started, how often they occur, what makes them better or worse, and any other information you think might be helpful.
So it's like we're detectives too, gathering all the clues we can.
Exactly. And don't be afraid to ask your doctor questions. The more you understand about your child's condition, the better equipped you'll be to make decisions about their care. And speaking of knowledge and decisions, I think it's time for us to wrap up this part of our deep dive.
Sounds good to me. But before we do that, maybe we can do a quick recap of what we've learned about these lab assessments.
Sure. So we talked about how lab tests aren't always necessary, but when they are, doctors try to start with the least invasive options and only move on to more invasive tests if they need more information. We covered chest x-rays, which give doctors a visual look at the lungs. We discussed pulse oximetry, which is that simple finger clip test that measures oxygen levels. And we touched on blood gas analysis, which gives a more detailed look at blood chemistry. And then, of course, we discussed the more specialized procedures like bronchoscopy and lung biopsy, which are used in more complex cases. How'd I do?
That was a fantastic recap. You covered it all.
Mhm.
Okay, I'm ready for the final part of our deep dive. What else do we have to talk about?
Well, now that we've explored all the technical aspects of pediatric respiratory assessment, I think it's important to step back and remember the human element of this process. We're not just dealing with symptoms and test results, we're talking about real children who are experiencing discomfort and fear. And as parents, caregivers, and healthcare providers, it's up to us to approach them with empathy and compassion. Really put ourselves in their shoes.
That's such an important point. I'm really interested to hear more about this.
Yeah.
Let's take a quick break, and then we'll come back and dive into that. All right, so we're back and ready to wrap up our deep dive into pediatric respiratory assessment. Before the break, we were talking about the human side of all this, and I have to admit it's something I don't always think about.
It's easy to get caught up in the technical details, but we can't forget that we're talking about real kids here, little ones who are scared and uncomfortable.
Yeah, I mean, imagine how scary it must be to be a child who's having trouble breathing. They don't understand what's happening or why they're feeling so awful.
Exactly. And that's why it's so important to approach these situations with empathy and compassion. Sometimes a child might seem uncooperative or resistant during an exam,
Right.
but it's often because they're scared or in pain, not because they're trying to be difficult.
That makes a lot of sense. So what can we do? As parents, caregivers, healthcare providers, how can we make this whole experience a little less scary for them?
Well, one of the simplest things is to just talk to them in a calm, gentle voice. Let them know what you're doing. Explain things in a way they can understand.
Yeah, that makes sense. And it probably helps to have a parent or caregiver there to comfort them too, right?
Absolutely. Having that familiar presence can make a huge difference. And it's not just about what we say, but how we act, too. A simple
Yeah.
smile can go a long way.
Right.
Making eye contact, getting down to their level, all those little things can help put a child at ease.
It's all about building trust.
Exactly. And sometimes a little distraction can work wonders, Having a few toys or books on hand or even singing a silly song can help take their mind off the exam.
Those are all great tips. It's
Yeah.
amazing how such small things can make a big difference in a child's experience. Now, you also mentioned something about empowering parents and caregivers to be advocates for their children. What did you mean by that?
Well, I think it starts with education. The more parents understand about different respiratory conditions, the more likely they are to recognize the warning signs and seek help early on.
That's true.
Yeah.
But there's so much information out there. Where can parents go to find reliable resources?
Well, the American Academy of Pediatrics website is always a good place to start. And there are organizations like the American Lung Association and the Cystic Fibrosis Foundation that have lots of great information too.
Those are great resources. But sometimes, even with all the information in the world, it can still be hard to know when to take your child to the doctor.
It's true. But I always say it's better to err on the side of caution. If you're at all concerned about your child's breathing, don't hesitate to call your doctor or seek medical attention. It's always better to be safe than sorry.
Absolutely. And when you do talk to the doctor, what are some things parents should keep in mind?
Well, be prepared to give them a detailed history of your child's symptoms. When did they start? How often do they happen? Does anything make them better or worse? The more information you can provide, the better.
So it's like we're playing detective too, gathering all the clues for the doctor.
Exactly. And don't be afraid to ask questions. The more you understand about your child's condition, the better equipped you'll be to make decisions about their care.
It sounds like being an informed and proactive advocate is such an important part of ensuring that children get the best possible care for their respiratory health.
I couldn't agree more. And as we wrap up this deep dive into pediatric respiratory assessment, I want to leave everyone with one final thought. Every breath a child takes is precious. Let's all do our part to protect their lungs and ensure they can breathe easily for years to come.
That's a beautiful message. And it's a perfect way to end our exploration of this incredibly important topic. Thanks for joining us on this deep dive. Until next time, stay curious, stay informed, and keep breathing easy.